We all take care of someone at some point in our lives. We can take care of a child, our parents, grandparents, partners, friends, pets. Care is very important, both in our families and in society in general. If you want to know more about care in English, of course, don't miss our next lesson. Let's start by defining what care means. Care is the process of protecting someone or something and providing what that person or thing needs. Have a look at these sentences. The standard of care in this nursing home is very high. He had an operation last week, so he needs a lot of care. Care is a noun, but we often use it combined with other words. To take care of, for example, is a phrasal verb we form with care. Have a look at these sentences. Take good care of your mother. She needs you. They can't take care of themselves. They always get lost. There are many words that contain the word care. For example, skin care. It's all about taking care of your skin. We often use the word skin care to talk about skin products like moisturising creams. Healthcare. It's all about taking care of one's health, as in healthcare system, which is the system that makes sure that everyone gets the medical attention they need. Childcare is everything related to the care of children. Childcare often refers to the service that is given to parents while they're working. Each country has its own institutions and systems to provide the care services that people need. In the UK, we have the National Health Service, also known as the NHS, which is the most important health institution in the country. The NHS provides free healthcare for all UK citizens, and it's paid for by the government through taxes. The NHS works as a noun. For example, some forms of cosmetic surgery are not available on the NHS. His operation was carried out by the NHS. The NHS can also work as an adjective, like this. My sister is an NHS doctor. I need to find an NHS hospital. We also have what we call nursing homes, which are places where people with health issues live and are taken care of. Nursing homes have medical and non-medical employees who give their residents assistance and medical treatment if they need it. Nursing homes are often for old people. In the UK, there is also something called community care. The community care system belongs to the NHS, and it offers care to people who are ill, disabled or very old in their own homes. So it's the opposite of a nursing home. With community care, you get the assistance you need in your own house. The idea behind this system is that people are better off in their own homes rather than in nursing homes or hospitals. Do you agree with this? It's a very interesting debate. Of course, we also have responsibilities as patients. We must learn how to recognise some symptoms. We mustn't take medicines or treatments without medical justification. We must try to communicate clearly with the medical staff. We must follow our doctor's instructions. We mustn't be late for our appointments. Those are our obligations, but they're not too much to ask, are they? Well, that was lesson 3. Alicia will take care of you now, and I'll see you in a minute.
This is a good moment to talk about must and mustn't, isn't it? Must is a modal verb that you already know, so this is just a reminder. We use must to express obligation or responsibility, especially in its affirmative form. For example, I must study harder or I'll never pass the exam. In negative sentences, we use mustn't, which expresses prohibition. For example, you mustn't smoke in the elevator. For questions, we don't use must really. We use have to, like this. Do I have to show my ID before I get on the plane? By the way, you normally don't have to, but you must keep it near you anyway.